The Tardieu Scale is a tool used to measure spasticity caused by upper motor neuron syndrome. Clients that have suffered from stroke, spinal cord injury, traumatic brain injury, or cerebral palsy are good candidates. Joanna was admitted to the inpatient rehab floor after being discharged from the acute wing in a regional hospital. She was admitted with a left cerebrovascular accident diagnosis. She has complained of stiff joints on right side, especially during elbow flexion. Her records indicate hypertonicity in right upper extremity. The assessment consists of clinical skill, disc form, and a goniometer to measure joint angles at different velocity levels. We will record the velocity used ranging from slow to high as V1, V2, or V3. Quality of muscle movement from a 0 to 5 scale ranging from no increase in tone to full contracture. The angle measured at slow speed recorded as R1 or at high speed as R2.
Hi Joanna, how are you today?
I'm good, how are you?
Good, my name is Haley. I'm going to be your occupational therapist today. I have an assessment that we're going to complete today that's called the Tardieu Scale. We're going to be measuring your spasticity. Are you aware what spasticity is?
No, I'm not.
Okay, so spasticity pretty much means when you have high tone through velocity. So that means if I'm moving your joint like your shoulder or your elbow at a really fast speed, we should be either having a catch where it's either going to be like really stiff, it's either going to completely stop at all, or it's going to eventually even oscillate like back and forth. So there's different ratings. So 0 means that there is no issue at all. Then we can move to 1, which is that means that you have a little bit of resistance, like it's a little hard, a little rigid. 2, that means you're going to see that catch. And then 3 means that you're going to see those oscillations where your muscles moving back and forth. And it's either going to go for less than 10 seconds, which is going to be a 3. A 4 is above 10 seconds. Or a 5, that means that I can't even move your joint. Which, do you feel like any of your joints you can't move right now?
Oh, my elbow.
Your elbow is okay. All right, so we're going to test that as well as every other joint. Are you in any pain right now?
No.
All right, wonderful. If during the assessment you feel any pain or you're tired, please let me know and I'll stop or we'll take a break. All right, so are you ready to get started? All right, wonderful. How long have you been at the hospital
For 3 days?
3 days? How's everything?
Everything's good, just the food is not that great.
Oh, I know. Hospital. Don't worry, you'll be going home soon. So what I want you to do is first we're going to work on your shoulders. So I want you first lift your arm up. You're going to bend your elbow straight like this. And the first one we're going to do is I'm just going to go really slow, like a stretch towards your body. Good. And I'm going to measure that stretch. Okay, so let's do that again. Okay. And let's do that stretch. Good. Can you hold it for me there? Okay. And then now this time we're just going to do it fast. Okay. All right, so now we're going to bring it down towards you. So let's try that again. And now. All right. Good. So now we're going to measure internal rotation. So there's 2 ways, wherever you feel more comfortable. You can either do it like this, or if it's more comfortable for you, we can go like this.
From here.
Okay. Let me do it and see if I need to measure this. Okay. So, all right. That seems good. And now we're going to be working on your shoulder. Do you need a break? All right. So we're going to work now on your elbow. So what you want to do is we're going to do the movement that is coming towards your shoulder and back down. All right. So we're going to do it a little bit faster this time, okay? And you said you had issues with your shoulders, so I want to take that measurement first. Okay. Right down. All right. Now that's good. All right. Give me just a second. I'll hold it right here. Okay. How's it feeling?
It feels alright, a little stiff.
All right, so I'm going to give you a 1-minute break and then we'll continue.
Okay.
All right, are you feeling much better now?
Yeah, much better.
All right, so So what we're gonna do now is we're gonna keep on working with that elbow joint if you're comfortable, and all we're gonna be doing is just twisting your hand. Believe it or not, it starts right over here, but if you're looking, great. So what I wanna do is just do a little bit faster. All right, so that's good. And then what we're gonna do now is measure the extension. First, we're gonna do it this much. I'm gonna do it fast now. Okay, let's measure that one, okay? I'm gonna go really slow. Okay, now I'm gonna add a little bit of speed. Alright, let's relax. Alright, you're doing great. I'm gonna have you lay down now, okay? Alright, so the first thing we're gonna do is I'm gonna have you extend your knee. Okay? And if you want, you can relax this knee down. Alright, perfect. Alright, so we are actually gonna start with your hip a little bit up. And I'm gonna bring it down. That seems good. Alright, and now let's work on that knee. Now we're gonna have your hip flexed. So we're gonna have your hip bent like this. Alright, and then first we're gonna work with your knee slightly extended like this, and I'm gonna bring it back down, okay? Alright, now let's do it. Hold right there. I'm gonna do it slow. I just need to take that measurement. All right, let's relax for a second. All right, we're gonna bend the hip again, and this time we're gonna bring the knee up. Okay. And first go slow. Okay, looks good. The last joint we're gonna work on is your ankles, and what I'm gonna do is I'm gonna stretch it towards you first, slow, and then fast. Okay, and that looks great. Alright, Jonah. So I'm gonna leave you in bed. Do you need let me get you a call light. All right, do you need any water? You want the TV on? I mean, I'm gonna get you the call light, so you should be able to turn on the TV. Do you need a pillow?
No, I'm good.
Okay, all right, wonderful. So if you need the nurse, the call light is here. Okay, I hope you have a good day.
You too.
Thank you for your time.